Hey, quick and straight to the point. If you breathe through your nose, chew real food, and improve your tongue and neck posture, your facial symmetry and oral health can improve over time. Now we all understand the body changes. It changes with exercise. It changes when we gain weight. That part makes sense. But the uncomfortable question is, what about your face? A lot of people think your face is factory locked, like an iPhone with no updates. Spoiler, there are adjustments. Quick fact, your face has 14 bones, and they're not all fused into one solid block. They have tiny amounts of movement. So, you're not Lego, but you're also not rigid concrete. And over the years, a few things can push the face to develop more asymmetrically. Why do we care about symmetry? Because your brain is nosy. Historically, symmetry has been linked with health. Fewer accidents, fewer developmental issues, fewer nutritional deficiencies. Attractiveness changes with culture and time, but health signals like facial symmetry stay pretty consistent.
Can symmetry be improved?
Yes, you can improve it. These bones don't fully fuse until very old age, and they keep a small amount of movement for much of life. If you take advantage of that over time, you can see meaningful changes in both health and appearance.
What causes asymmetries?
Okay, first, what can throw your face off? A few big ones. Smoking, dental problems, bad posture, even something like having worse vision in one eye than the other. And people always ask, is this genetics? Or habits? There's a cool way to test that. Twins. A 2014 study looked at 147 pairs of twins. Because if they're genetically very similar, you can see what habits make the difference. Science mode, without the drama.
What did you find?
Here's what they found. People who slept face down tended to have more deviation, like the nose and the corner of the mouth shifting toward one side. And people who smoked or had dental extractions tended to have more cant in the bite plane, meaning one side of the mouth sits lower than the other. So the practical takeaway is simple. Sleep on your back or your side. Avoid cigarettes. And fix any dental or bite issues you have. If your face is drifting to one side, it might not be bad luck. It might just be your pillow causing chaos. Now let's talk about what really moves bones. We've covered passive forces, like sleeping positions. But what moves bone in a meaningful way? The same thing that influences bones everywhere else. Muscles. This is huge, because the tension in the muscles of your face, mouth, and neck affects symmetry a lot. And here's the problem. Modern food is so soft. In the Paleolithic era, people ate tougher foods. They chewed more. They used their jaws more. But now it's like purees, smoothies, soft bread. And your body goes, oh, okay, then I don't need to develop this area as much. Over time, chewing tougher food tends to support stronger chewing muscles, a more developed jaw, and a wider dental arch.
And how does that help me?
That extra space matters. More space can mean less crowding, fewer bite issues, and fewer wisdom tooth problems later. If you eat soft foods your whole life and the jaw doesn't develop, you can end up with crowding, altered bite, and more asymmetry in the lower face, because there just isn't enough room. It's like trying to fit 12 people into an elevator built for 6. Someone is going to end up sideways. So one practical move is simple. Chew more, ideally with real food. And yes, chewing can even help you extract more nutrients from food. And if you pair that with a lower glycemic diet, you support your teeth, your oral bacteria, and you reduce the chance of losing teeth as you age. That's why in the Paleolithic era, wear from chewing was common, but losing many teeth due to cavities or infections was not as common. Now, the secret muscle is the tongue. Your tongue is stronger than it looks. It's like that quiet friend at the gym. And then, suddenly they lift double. The tongue influences how the palate and upper jaw develop from the inside. Good tongue posture, resting up against the palate, helps guide the upper jaw forward and wider.
And what happens if I can't breathe well through my nose?
When tongue posture is poor, the face tends to grow more downward instead of forward. And this isn't only about looks, it's connected to health too. So what should you do? Improve tongue posture. I don't care if you're 18 or 600. Better tongue posture can improve breathing and make nasal breathing easier, especially during sleep. Quick test. How do you swallow? Here's a simple swallow checklist. Tongue against the palate. Tongue tip on the little resting spot behind the front teeth. Head neutral and straight. Swallow without pushing your teeth forward. If that feels hard, it might be because your usual swallow pattern isn't ideal. And yes, there are exercises that help correct atypical swallowing.
Can the tongue move teeth?
Yes. According to one study, it takes about 1.7 grams of force to move the incisors, and the tongue can apply up to 500 grams. So if your tongue were a person, it would be banned from boxing for excessive power. If the tongue can move teeth, it can influence facial development over time. Mewing is a technique linked to Dr. Mike Mew. The idea is to place the tongue fully on the palate and apply gentle upward and forward pressure consistently. In more severe cases, professionals use devices to guide development. But for most people, it's about two things: fix the swallow pattern and set a daily reminder to return your tongue to the correct resting position. The goal is simple: tongue up on the palate whenever you're not talking, eating, or drinking. Basically training your tongue not to live like a freelancer doing whatever it wants. Next big topic: mouth breathing. If your nose is blocked or you have allergies, you'll breathe through your mouth, and that can change development. Mouth breathing is linked to more respiratory infections, and it can even reduce oxygen delivery efficiency to the brain. And with the mouth open, tongue posture changes, which can narrow the dental arch and push growth downward instead of forward. So, in summary, mouth breathing tends to create a smaller arch and a longer, downward facial pattern. If you've had years of allergies or obstruction, first step, check whether you can breathe through your nose while sleeping. 8 hours of mouth breathing is a lot. You can ask someone to observe you or use gentle, hypoallergenic lip tape to keep the lips closed at night. And if you're a chronic mouth breather, one method people use is the Buteyko approach. Nasal breathing focuses on breathing through the nose at all times, day and night, to warm, humidify, and filter the air. Volume reduction teaches slower, gentler breathing, reducing the need for excess air and preventing overbreathing. Breath pauses includes breath hold exercises after exhalation to improve carbon dioxide tolerance and help relax the airways. Now, last piece, neck posture. Your neck also has a vote. If your head is pushed forward, it effectively becomes heavier for your torso than if it's aligned. It's hard to have good breathing mechanics and harmonious facial development if your head lives forward all the time. Neck stretches. Postural exercises. Anything that counters phone posture, because your neck was not designed to live life in shrimp mode. So here's the big summary. Chewing muscles and the jaw support wider, more lateral development. Tongue posture and the upper arch support forward development. And that combination can improve facial symmetry and proportions over time. For most people, these techniques are low risk, free, and improve quality of life. The main exception is if you have serious TMJ issues. Because yes, you can train your face, but don't worry, I'm not going to make you do nose squats.